Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. So far, over 68,000 New Yorkers have been vaccinated as New York City continues to roll out COVID-19 vaccines. What are some of the symptoms you may experience? How should you prepare for a vaccine? Answering these questions and sharing her own experience with the COVID-19 vaccine is Dr. Denise Nuñez. She is a pediatric intensivist and founder of Dr. Urgent Medical Care located in the Belmont section of the Bronx. Welcome, Doctora. Thank you so much for joining us today.
Thank you so much for inviting me, Sanji. Thank you.
Claro. So the first thing, of course, how are you doing after taking the vaccine? I know that you got the Pfizer COVID-19 vaccine. Could you just share how you're feeling today and your experience with us?
Oh, thank you so much. So I'm feeling much better now. I'm not sure if the tiredness is because of work or because of the vaccine, but I did get the vaccine of about a week ago, if I can recollect. And I got it a little bit late. It was the day of the snowstorm, the first snowstorm we had. So it was kind of like the snowstorm, and trying to get home and from the hospital. So I received the vaccine that night. Very painful, extremely painful. I'm also very scared of shots. Mind you, being a doctor, right? But I'm very scared of shots. So it was very painful. But didn't pay much mind because I was driving and needed to go back home. So that was around 7 o'clock at night. And I do remember going to sleep because I felt kind of a little bit tired, but at the same time, I was what we call post call. So I was like worked all night and then I got home. So I was tired, but did feel a little bit different, but went to sleep. When I woke up that morning, I woke up with a fever,
Mm.
woke up with huge body aches and I couldn't lift the arm. So I did go to work. I definitely recommend not to do that, but I did come to the urgent care. Actually didn't go to the hospital, and I could not see patients that day. I was literally just doing admin work because the fever would not go down the entire day. So I took a lot of medicine for the fever, which actually hurt my stomach a little bit. But I stayed like that for about almost full three full days, with like 72 hours,
Wow.
with fever medication and pain medication. My head was hurting a lot for the 3 days too. Um, then, like by the fourth day, it was like magic. I was back to normal. My arm did still hurt it a lot, but I was much, much better, thank God. So, a lot of my colleagues sort of felt the same. The fever, the headache, the body pain. Added also had more stomach aches, and some sort of loose stools, diarrhea, what we called. So they had that extra that I did not have. And others didn't have anything. Others were fine. So yeah, that was my experience with the
Mm.
COVID.
Thank you for sharing, doctor. And you've also shared your day-to-day experiences since you got the COVID vaccine on social media in Espanol. So,
I,
thank you for that. I know that a lot of people follow you and stay in touch in regards to the COVID vaccine. We're all very worried about, the experiences. So thank you for being honest about how you took the vaccine as a doctor as well. So you said it took over 3 days to overcome the symptoms, and it's kind of common to have these symptoms that you had as well.
so it's kind of common to have anything after you get a vaccine. You know, your body is sort of like double working, trying to get all these immunoglobulins, all these antibodies, creating all this. So it's like you're in an inflammatory state. So you're working hard inside. So your body is very, is feels sick. Um, and what Pfizer has shown in their studies is that you do get, you can get these reactions. So these reactions are common when you're producing the antibodies for a vaccine. Some vaccines are a little bit more baby febrile. Um, Flu shot sort of feels the same as kind of feel like you have a cold. Um, for me, I haven't had that reaction. I never had that reaction before, so it was something different, a little bit scary, but I knew it was a vaccine because there was nothing else I did that day. And as I said, other colleagues have had other symptoms come different from mine and almost similar to mine.
Right. And now, doctor, people are fearing a new highly transmissible coronavirus strain. Can you tell us a little bit more about the COVID-19 mutation coming from the UK and
Sure,
what people should know about it?
sure, sure. So first of all, people have to understand that all the viruses mutate. So it's nothing new. It's just new for people to listen to hear that, because we don't say it a lot, like doctors are not always talking about that. But a little bit of an example of that is the flu shot, right? The flu vaccine. So it mutates every year, and every year we add strains to the vaccine, and we get new vaccines every single year. And we don't cover all the strains. Like, you literally get a vaccine and you get another mutation. So all the viruses mutate normally. The COVID actually started mutating since the beginning of the year. So I think it's over 17, not 27, but it's over 17 definitely. Uh, uh, Mutations that the virus already had. And in about
Oh.
September, there was a strain found in the south of London, that now they know that is definitely more transmittable. So people get more infected. And the way they found this out is that they actually did studies, and they swabbed some people with this new strain, and they found there's more viruses in the throat and in the back of your nose. It's like the amount of viruses found there compared to other people were much higher. And also in November, 28% of the population in England, of south of England, of England, had this strain, compared to December, where already 68% of the people had it. So it means that it's just growing very fast. The good thing about this is that now Pfizer and Moderna both have been testing people that already had the vaccine, taking their bloods out, taking this blood to the lab, and injecting the the COVID with the new strain COVID to it, and they're seeing that it is working. So it's mutating, it's stopping the COVID-19. So
Got
we don't
it.
have to be that worried. Definitely, there's more studies to come. Those are just preliminary studies out there, so it's nothing still set in stone. But for now, the COVID vaccines that we're getting, Pfizer, Moderna, definitely are able to inhibit the COVID-19
Thank you
virus.
for sharing, doctor. And
Sure.
I wanted to also ask, President-elect Joe Biden recently stated that Americans won't be forced to take a coronavirus vaccine. As a doctor, what are your thoughts on this? And should COVID-19 vaccines be mandatory, possibly?
So I don't believe on mandatory. I mean, I think everybody has a right to refuse things, or I'm very more of a team player. I'm an intensivist. I have to work with the team and have to get along with the team. So I have to, everybody has their own concepts of things. So I don't believe things need to be mandatory. I do think that people have to understand what's going on, and have to understand what's going on with the population, and be informed, right? So what do you want? Like, you have to think, well, do you want to get COVID or get the COVID vaccines? You have to sort of think that way. And I know a lot of people are still skeptical about the COVID-19. When they're in front of me, you can't talk much, because
Mm.
I'm day to day since this all started on the front of the battle, and you know, working with patients that have died in front of me. We used to have like one person die every, I don't know, every 2 to 3 weeks,
Mm.
and it got to a point that we had like 10 die, and just back to back in a day. And when this second wave started, we had like a little recess. We were kind of calmer. We can take a breath in your breather, and eat something, go to the bathroom. And then all of a sudden, about, I would say maybe 3 weeks ago, we were signing out. I was signing out with my colleague in the ICU, and literally we couldn't finish the sign out. It was like 10 minutes into it, and we had like 6 interruptions. We could not like finish the sign out, because
Wow.
we can hear the alarms of all the other floors in our floor. And it just didn't, and we looked at each other like, okay, here we go again. We have to
Mm.
get prepared. So you have to make that decision if you want to go through COVID. And people say, well, not everybody gets sick, but you don't know if you're going to be, how you're going to react to the vaccine, right? Yeah, to if you get COVID, right? One of the things I actually spoke about yesterday was with my community, was that a lot of my kids and my parents have gained a lot of weight, right? And just going a little bit on tangents here, but so you get the idea. Gain a lot of weight with the quarantine, 20 pounds, 30 pounds, just one, and a kid, and it's surprising, right? So our rate of our overweight rate for USA is anywhere from 20 to 40%, 40% adults, 20 to 40 for kids. And one of the things that I realized when all this started, and things that I've learned now with COVID, is that most of my patients that got sick, and not only sick, but got admitted in the ICU and died, most of these patients were obese. So there is a study that I looked at, and I've been looking a lot into all this information, and I read a couple of the studies about 400,000 patients that had COVID. Um, when you compare patients that are healthy to obese patients, and I'm talking about healthy, and I'm not talking about comorbidities, anybody that's healthy compared to just obese patients, 113% of these patients, 113, so all of them got admitted to the hospital. 75% got admitted in the ICU, and over 48% died. So that tells a lot. So that means that we have to be careful. We are not, you know, most of us are not overweight, but we're not on our correct, healthy weight. And when you're obese, you have, or you're inflammatory, your immune system is depressed because you have your how you call this? Um, I'm so sorry if you can hear the background. I'm in the clinic actually, so sorry for that. Um, the obesity actually creates an imbalance of your hormones and makes your body inside react like if you have COVID. So you're like a perfect patient for COVID to come in and to have a very severe reaction. So um, I said you just have to look at the numbers, see how many patients, look at the amount of deaths we had already, how many people have died, and how many people have been and consequences. Not people that are not that didn't die, but they have a lot of consequences: renal failure, lung failure, patients that needed transplants right now, and a lot of sequelae that all these patients have. So you have to be careful. You have to think very well if you want to, you're going to be exposed to COVID. All of us are going to be exposed to COVID. There's like this. Don't believe that in this day and age that you're not going to somehow somewhere you will get exposed to COVID. So why not be prepared and get your vaccine so at least you can fight that and not get sick.
And for someone listening now, doctor, are you offering vaccines at your practice at the moment?
Not so it's right now. There are different phases right now. The first phase is a hospital, so they're still on that category and trying to get all the doctors vaccinated. And in the news, it came out there's I think only a certain amount of doctors have been vaccinated yet still. So there's still more doctors to be vaccinated. So
Got it.
they need we're getting more vaccines slowly the hospital. So that's I think they need to finish that stage first until everybody else starts getting vaccine.
Got it. And doctor, how can people stay in touch and also visit doctor urgent medical urgent care at this time? For preventative care, I think one thing people need to remember is that they still need to be visiting their doctor and taking care of themselves. As you said, compromised immune system is something that you don't want at this time. So
Yeah.
just any numbers, contact
Yeah, sure.
information that
Yeah, I think
contact.
what you said was very, very important. One of the issues that we found a lot was that patients were not going to their doctors and they were getting very sick. And then we were seeing them in the ICU were things that they could have, we could have taken care of as a community provider. So yes, please go to your doctors, call them up, see which way you're able to get in touch with that telehealth, whatever it is. I am, as you know, in social media a lot. So at Dr. Denise Nuñez is my social media, but the clinic is 347 630 2323. That's the urgent care here in the Bronx and also in Manhattan. So absolutely our pleasure, and we'll, as much as we can, we'll help out.
Thank you, Dr. Nunez, for sharing your experience with us with taking the COVID-19 vaccine. And I'm glad that you're feeling better now and back to taking care of folks. I know you've been on the front line since the beginning of the pandemic. So thank you. And all the thanks to you and gratitude to you and your all the workers and your crew over at your practice.
Thank you so much. Thank you so much for taking this time and for inviting me. Thank you. That's a pleasure.
We'll be right back with Open BXRx.